Doctor, you can start now.
Blood sugar. Moving to diabetes mellitus. Diabetes is a general term for disease, which means excessive urination. Usually, it refers to diabetes mellitus. It is a group of metabolic diseases in which a person has high blood sugar. It may be due to the body doesn't produce insulin and cells don't respond to the insulin which is produced in the body. And the insulin is secreted by the beta cells of pancreas to control blood sugar levels. The pathophysiology of diabetes. Insulin is the hormone that regulates the uptake of glucose from the blood into the most of all the cells. Therefore, deficiency of insulin or the insensitivity of its receptors plays a central role in all forms of diabetes mellitus. So, food intake leads to it finally converted into simple forms, that is monosaccharides, that is used as energy for the body. That is mainly by the function of insulin. Insulin is released by beta cells of islets of Langerhans, responses to rise the blood sugar level and helps to absorb glucose or for storage. It also helps in conversion of glucose to glycogen and stores in liver and muscle cells. Higher insulin level increases some anabolic process like cell growth, protein synthesis, and fat storage. Low insulin level triggers the process of ketosis. If the amount of insulin available is insufficient, or cells are insulin insensitivity, or if the insulin itself is defective, then no absorption of glucose from the cell, and this results in one is high level of blood glucose, and the second one is poor protein synthesis and other metabolic derangements. And when the glucose level or concentration in the blood is raised beyond its renal threshold, that is about 180 mg per dl, but altered in few conditions like pregnancy, and reabsorption of glucose in the proximal renal tube is incomplete. Part of glucose remain in urine, and this increases the osmotic pressure of the urine and inhibits reabsorption of water by the kidney. And this results in increased production of urine, that is polyuria, and increased fluid loss. As water loss is more from the body, it leads to dehydration and increased thirst. That is the diabetes. And these are hormones that glucose, that insulin, somatostatin, glucagon, epinephrine, cortisol, ACTH, growth hormone, thyroxine, etc. And the signs and symptoms. So the increased thirst, frequent urination, and mainly the cardinal symptoms of diabetes is polydipsia, polyphagia, and polyuria. That is increased thirst and increased hunger and increased urination. And the other clinical features are increased thirst and frequent urination, unexpected weight loss, increased fatigue, blurred vision, numbness and tingling, especially in feet and hands, and slow healing sores, and red swollen tender gums. Skin will be itchy and irritability will be there. And also you can see like weakness will be there, lethargy, and also you can see white patches in the mouth or oropharynx, and candidiasis, fungal infections, and almost the infections is very common if the patient is if he is diagnosed with diabetes, and like white vaginal discharge, and almost all infections like recurrent skin infections, and the skin will be dry and scaly skin and delayed healing, and diarrhea sometimes. Most commonly constipation will be there, and urinary incontinence and erectile dysfunctions that is due to neurological deficit, and these are the common signs and symptoms. And in and these are the common symptoms, and there are some uncommon symptoms are also there. That is otorrhea, and otorrhea, it may be for 1 to 2 weeks, and it is followed by otalgia, and which may be followed by facial nerve paralysis, and later features of meningitis will be there. And these are the uncommon symptoms. And you can also see hypoglycemic symptoms, that is if the patient is on um, diabetic drugs. So there are three chances for this hypoglycemic symptoms. Suppose the patient is taking the overdose, insulin in overdose. And the second chance is when a patient skips or delayed food after taking insulin or any oral medication, means oral diabetic medication. And the third chance is severe exercise after a normal dose of insulin or oral drug. So in these cases, the hypoglycemic symptoms we can see, that is the fast heart beating, sweating, weakness, fatigue, and anxiousness, hunger, headache, dizziness, irritability. These are the hypoglycemic symptoms. And moving to the types of diabetes mellitus, mainly it is type 1 diabetes and type 2 diabetes, and also gestational diabetes also there, and and the other types of diabetes, it is neonatal diabetes mellitus, and one more is MODY, that is maturity onset diabetes of the young. So we'll move to the type 1 diabetes. It is insulin dependent diabetes mellitus, that is IDDM. It manifests due to the autoimmune damage of beta cells, which then leads to the suppression or cessation of insulin production. And that is a juvenile diabetes, and patients with diabetes type 1 are unable to produce insulin. And the next is the type 2 diabetes, that is non-insulin dependent. There is no loss or moderate reduction in beta cell mass, and insulin in circulation is low, normal, or even high. And type 2 generally appears later on in life, and this is the most common form of diabetes. And in the case of insulin resistance, the body is producing the insulin, but insulin sensitivity is reduced, and it does not the job as well as it should do. And one more type is gestational diabetes. It is nothing but it only happens during pregnancy. It means you have high blood sugar level, but those levels were normal before you were pregnant. And after the baby is born, gestational diabetes usually goes away. And gestational diabetes makes you more likely to develop type 2 diabetes mellitus. And how it causes, that is during pregnancy, the placenta makes hormones that can lead to a buildup of glucose in your blood. So usually your pancreas can make enough insulin to handle that. If not, your blood sugar levels will rise and can cause gestational diabetes. And the risk factors for gestational diabetes, it is the ages. Women older than age 25 are at increased risk, and the family or personal history, if any family member is diabetic, then also the woman is at higher risk. And one more type is MODY, that is maturity onset diabetes of the young. And it is a rare form of diabetes which is different from both type 1 and type 2 diabetes, and it is caused by a mutation of change in a single gene. And this is the comparison of type 1 and type 2 diabetes. The onset for type 1 it is sudden, and type 2 is gradual onset, and age of onset it is mostly in children, mostly young age, and in type 2 mostly in adults. And the ketoacidosis it is common in type 1 and it is rare in type 2. And the pathogenesis it is type 1, that is autoimmunity, and in type 2 it is insulin resistance. And weight will be normal in type 1, and in type 2 obese, and prevalence approximately 10 percentage for type 1 and 90 percentage for type 2 diabetes. And next is the clinical examinations. We have general assessment and locoregional examination for diabetes. So when it comes to general assessment, so if the patients with altered consciousness, in that state we have to check the mental state of the patient. Um, because there is chance of altered consciousness, and we have to check the pulse, BP, respiration, and the state of hydration, that is like skin and mucous membrane, and whether it is dry or not, that we have to check. And if the patient is conscious, we have to check the BMI of the patient, and the orthostatic BP also we have to check. And the locoregional examination. Why? Because diabetes mellitus affects every system of the body. So we have to examine from head to feet. Okay. And first one is the examination of head and neck. And we have to examine first cranial nerve palsy, ptosis, and also for carotid pulse. And next is the examination of eyes. In that, yeah, we have to check for diabetic retinopathy, visual acuity, and corneal arcus, cataract, and fundal examination also for the diabetic retinopathy. And next is the examination of buccal cavity, and in inspection we have to check for puffy red gums, plaques, decayed teeth or bad breath, or um, like halitosis and gingivitis, etc. And next is the examination of skin and nail. In that acanthosis nigricans over the axilla, that we have to check. And we have to check for repeated fungal nail infections also. And the examination of hands, that is like trigger finger and dupuytren's contracture, and also for like some signs like Tinel sign, Fallon sign, that is for carpal tunnel syndrome. That also we have to check. Next is the examination of abdomen. The possible findings are hepatomegaly, that is, it is associated with fatty liver, and the abdominal tenderness, maybe in ketoacidosis you can see. And next is the examination of legs. And the possible findings are calf and thigh muscle wasting, that is in case of neuritis condition, and also sensory abnormality, and the dry skin and hair loss, that is due to dehydration, and absent or weak femoral pulse, and loss of knee or ankle joints. And next is the examination of feet. In inspection you can like deformities like charcot neuroarthropathy or the claw toe, and you can see the callus also you can see, and loss of plantar arch and diabetic foot ulcer, and discoloration of the skin, and fungal infections also you can see in the feet. So, in diabetes, you have to examine from the uh, top to bottom because diabetes affects every system of the body. And moving into the complications, like acute complications with diabetic ketoacidosis and hyperosmolar hyperglycemic state. So, what is diabetic ketoacidosis? It is most serious acute metabolic complication of diabetes mellitus and common cause of death in modern era, occurs typically in untreated patients of diabetes mellitus 1 with absolute insulin deficiency and also in patients with a relative insulin lack such as in diabetes mellitus 2. And the chronic complications, like it can be divided into two groups, like one is the vascular complications and the next one is the non-vascular complications. So under vascular complications there will be micro complications and macro complications, and the microvascular complications are retinopathy, nephropathy and neuropathy, and the macrovascular complications are coronary heart disease, peripheral arterial disease, cerebrovascular disease. And the next category, non-vascular complications, that is mm, like diarrhea, sexual dysfunction, recurrent infections, cataract, um, pigmented pretibial papules, and acanthosis nigricans, pruritus. All these are the non-vascular complications. So the diagnosis, and clinically we can diagnose with the three cardinal features, that is the polyuria, polydipsia and polyphagia. And the laboratory investigations like fasting blood sugar and like random blood sugar and ppvs postprandial, and also gtt, that is glucose tolerance test, and hba1c is the confirmatory test. So the fasting normal, it will be approximately less than 100, and in pre-diabetes it is in between 100 to 125, and it is diabetes greater than 125. And postprandial, if it is less than 139, it is normal. Pre-diabetes 140 to 199, and diabetes is greater than 200. And HbA1c, the normal sugar level, it is less than 5.7, and in pre-diabetes it is 5.7 to 6.4, and diabetes is greater than 6.5 and above. And the oral glucose tolerance test, it measures blood sugar after person fast for at least 8 hours and 2 hours after a person drink a liquid containing 75 grams of glucose dissolved in water. And other investigations advised are serum insulin levels. It helps to differentiate in D1 and D2. Sorry, type 2. And in D type 1, levels are low, and in type 2, first, when there is insulin resistance, insulin levels is high in early stages, and when there is onset of islet cell failure level goes down. And the management of type 2 diabetes. So first we have to diagnose, then the therapeutic lifestyle change. So what is the lifestyle modifications? That is Low fat and low carbohydrate diet, small frequent meals to avoid hypoglycemia, the exercise, at least half an hour of exercise like brisk walking is advised, and avoid alcohol and smoking, and stress management with meditation or relaxing therapies like music. And the pharmacological treatment, like in type 1 diabetes, the insulin injectable is the main treatment, and in type 2, oral hypoglycemic drugs. But in late stage or who develop complications like renal failure may require insulin for treatment. And the drug classes used for the treatment of type 2 diabetes includes by beginnings, that is nothing but metformin. Metformin works by decreasing hepatic gluconeogenesis production, and it also decreases intestinal absorption of glucose and improves insulin sensitivity by increasing peripheral glucose uptake and utilization. And it promotes modest weight loss. And contraindication is in nephropathy, in serum creatinine if it is greater than 1.7, that in severe hepatic failure. And the next one is sulfonylureas, that is for example glyburide or glimepiride, those things. They are insulin secretagogues that stimulate insulin release from pancreatic beta cells. They enhance peripheral sensitivity to insulin, secondary to an increase in insulin receptors. And the side effects will be hypoglycemia, slight weight gain, increased risk of cardiovascular diseases, etc. And the contraindication is hepatic and renal failure. And the alpha glucosidase inhibitors, these agents delay sugar absorption and help to prevent postprandial glucose surge, and do not affect insulin secretion and utilization. And this should be administered before meal. And the contraindication is an IBS and gastroparesis, and if serum creatinine is greater than 2, and type 1 diabetes also. And the GLPI analog and DPP4 inhibitors, they enhance pancreatic insulin secretion and should not be used along with insulins and sulfonylureas. The CZDs, and they act as insulin sensitizers, thus they require the presence of insulin to work. And they are the only anti-diabetic agents they have been shown to slow the progression of diabetes. So this is regarding the diabetes mellitus. So we discussed about what is diabetes and the pathophysiology of diabetes and the common clinical features, common signs and symptoms also we discussed, and uncommon symptoms also, and the types like type 1, type 2, and gestational, and MODY. And next we discussed about the investigations and about the like in examinations like general examination and the locomotor examination, and then finally the treatment. So this is just a introduction about diabetes mellitus. So next we are moving to the Ayurvedic aspect, that is prmh. And prmh, it is a broad term. Actually in diabetes, the diabetes, it is like it is diagnosed on the basis of the increased blood sugar. But prmh, it is a different concept. So we'll move into that. So Prameha in Charaka Chikitsa, it is explained as the sixth chapter, that is after Gulma, because what is comes is Prameha. So it is explained after Gulma. But in Madhava Nidana, it is explained in the 33rd chapter, that is after Ashmari. 32nd chapter is Ashmari. And also in Ashtanga Hridaya Nidana, it is explained after it is explained in the 10th chapter. That is after 9th chapter is the Mutrakhata Nidana, and the 10th chapter is the Prameha Nidana. So in the Mutravaha Srodha Dushti diseases, it is Mutravaha Srodha Dushti, it is of Apravarti and Atipravarti. Right? So in Apravarti, the diseases comes up Mutrakrishna and Mutrakata. It includes Ashmiri also, Mutrakrishna and Mutrakata. And the diseases due to the Adipravarti, Mutravahasrutu, Adipravarti, it is the disease Prameha. So after Apravarti, that is after Mutrakata, it is explained Prameha, that is the Adipravarti. So that is the order. So this is a Medovaha disease. So what is the Medovaha Strodomula? That is Brika and Babavahana according to Charaka, Kadi and Brika according to Sushruta. So just keep in mind this Medovaha Strodomula. And also keep in mind that Mutram. What is Mutram? It is the Annakleda Nirvahanam Mutram. And the Sveda is Sveda, it is Kleda Dharana. So we'll move into the Nidana. So this is according to the Charaka. According to Charaka, Asya Sugam, Swapna Sugam, Dhatini, Gyamya Udaka Anuparasa Payamsi, Nava Anna Pahanam, Udavaikritam Cha, Premeha Hedu, Kapagricha Sarva. And this is from Charaka. And from Ashtanga Hridayamidana, that is the Swatu Amla Lavana Snigdha Guru Pichila Shitalam, Navadanya Sura Anupa Mamsa Ikshu Kudar Gorasam, and Ekasthanasana Radishayanam Vidivarshita. This is from Ashtanga Hridaya. So when it is categorized into Ahara and Vihara, that is the food which are sweet, sour, salt, fatty, not easily digestible, slimy, and cold, unlike fish beans, sura, or the anupamamsa, ikshurasa, kshira, etc. And vihara, it is egasthana shayana, it is always sitting at a place and sleeping and adopting sedentary lifestyle, disregarding proper rules of rest. So this is Nidana. So in this we know the treatment. Usually, the treatment is basically it is the Nidana Parivarshana and the Samprapti Vikatana. So, Nidana Parivarshana is the first line of treatment and the Samprapti Vikatana. So, in PG level, you can write like this. If a question asks for like Prameha Chikitsa, you can write like starting from Nidana Parivarshana instead of your usual writing like Nidana, Purvarupa, Samprapti. Uh, in those pattern you are writing, but instead of that, you can write like the Chikitsa is Nidana Parivarshana and Samprapti Vikatana. So write about Nidana first. that is Nidana Parivarjana. For Nidana Parivarjana, we have to talk about what are the Nidanas, right? So write about Nidana first. And next is the Samprapti Vikatana. So in that you can write the Samprapti. So that is one pattern of writing in PG. Okay, so in your clinical aspects also you can, like in most of us we are if we are advising diet for diabetes patients, we usually tell Madhura Rasa to avoid Madhura Rasa. But here you just keep in mind that in Ashtanga Hridaya it is explained that Swadu, Amla, Lavana. Three doshas, three rasas it is explained because it is Prameha is a Kleda Pradhana. As you know, the Prameha it contains 10 doshas are explained. So it is a Kleda Pradhana disease. So these all three rasas, this will increase the kleda. So not only Madhura rasa. So while giving advice, we have to keep in mind that it is Padu, Amla, and Lavana. Three rasas are there. So we have to tell the patients to avoid not only Madhura but also this Lavana and Amla also. Okay. And next is the Samprapti. So due to the Nidana, the Kapha dosha takes initiation of causing Prameha. The cofactors that depend on kapha is rasa, mamsa, medas, majja, shukra, lasika, vasa, and ojas. Among them, the medu dhatu has the quality of binding all these factors together. Thus, the huge dhatu complex gets associated together, and due to the gurutva, all the elements travel downwards and reach basti. As the function of basti is to excrete mutra, the above said dushta khaba and dushta dhatus get mixed with mutra and eliminates out of the body with mutra. Thus, due to admixture of dushta kaba dosha and dushta dhatus with mutra, there is increased volume and increased frequency of micturition. Thus, the name Meha or Prameha is given to the disease. And this is the Nidana as per Ashtanga Hridaya. And next is the Purva Rupa. So the sweating, body odor, like flabbiness of the body, like liking for constantly lying on the bed and sitting, sleeping, and leading an easy life, a feeling as if the cardiac region is covered with extraneous material. And all these are the Purva Rupas. And also in Ashtanga Hridaya Nidana chapter, that is Sveda Angagandha, Shitilatvamangi, Shayasana Swapna Sukabhishanga, Trinnetra Jiva Shravanopadehu, Khanangata Keshanaka Adivratti. This is according to Ashtanga Hridaya Nidana. And also like in Ashtanga Hridaya Chikitsa also it is explained Svedo Angakanda, the theme which is there in slide. Svedo Angakanda, Shidila Ankacha, Shayasana Sopna Suki Redisha, Trinetra, Jihva Shravana, Shravanopadehu, Ganankata, Keshanakha Divriddhi, Shida Priyatvam, Galataru Shoshu, Madhurya Masi, Karapata Daha, that is Bhavishyado, Meha Gadasya Rupam, Mutre, Abhidhavandi, Pipirikasha. That is sweating, emanation of foul smelling from the body, and flabbiness of the body, like liking for constantly lying on the bed, sitting, sleeping, and leading an easy life, a feeling as if the cardiac region is covered with extraneous material, exudation of excreta from eyes, tongue, and ears, and corpulence of the body, excessive growth of hair and nails, liking for cold things, and dryness of throat and palate, sweet taste in the mouth, burning sensation in hands and legs, and the crawling of ants on the urine. These are the signs and symptoms of approaching to Prameha Roga. These are the puberty parts. And what is the Samanya Lakshanas? That is the Samanya Lakshana is Satra Prabhuta Avila Mutrata. That is the increased quantity of urine and the increased turbidity of urine. And next is the types of prameha. That is total 20 types of pramehas are explained. And the kapha is 10 and pahitika is 6 types and the vata is vadika type is like 4 types. So these are the types of meha, like the kapacha, udaka, ikshwalika, sandrameha, and shuklameha, sitameha, sikatameha, shanarmeha, lalameha. And Paitika, Kshara, Neela, Manchishta, Kala, Rekta and Haditra, and in Vadacha, Vasamaja, Hasti, and Madhumeha. So please go through the lakshanas of these individual types of prameha. And next is the prameha pitaka. Prameha pitaka, that is the pitaka or carbuncles. They are skin like a skin, the carbuncles that manifest in the prameha patient in whom there is excessive accumulation of vasa, meda, which gets mixed with prakupita tridoshas to cause 10 types of prameha pitakas. That is, the pitakas are Sharavika, Sarshapika, Kachapika, Jalini, Vinata, Putrini, Masurika, Alaji, Vitarika, and Vitrati. The reference is from Sushruta Nidana, 6th chapter, 16th shloka. And according to Charaka, the Pidakas are Sharavika, Kachapika, Chalini, Sarshabi, Alaji, Vinata, and Vitrati. And the Sharavika type, it is the Antonada Madhyanimna Shava Kledaruganyvita Sharavika Syat Pidaka Sharavagriti Samstita. That is, the lesion is raised in border but depressed in the middle, blackish discoloration, and associated with discharge or moisture and pain. The lesion resembles like that of an earthen saucer, like Sharavika only. And next is the Kachapika, that is Antonata Madhyanim, Avagadarthi Nistoda Mahavastu Parigraha
Slakshna Kachapa Prishtava Pidaga Kachabimada. That is, the lesion is deep seated, associated with severe pain, um, widespreading burning sensation, and it is soft and that resembles the back of tortoise. That is Kachapika. And next one is Jalini. That is Tabda Sirajalavati Snigdha Srava Mahashaya Ruja Nistoda Bahula Sukshma Chidracha Jalini. That is, the Pidaka is hard and surrounded by a network of blood vessels, appears red, associated with aqueous discharge, and has deep base and small openings through which discharge takes place when patient experiences various kinds of pain. And the Sarshabi, that is Pidaka, Na Adimahati, Shiprapaga Maharuja, Sarshabi, Sarshabhavi, Pidagavishchida Bhavid. That is, the lesion in this type of Pidaka is not so big in size and resembles to white mustard seed, and it separates quickly, associated with severe pain. And the allergy, that is Dahadi, Tvajamuthane, Trishna, Moha, Chvaraprada, like Visarpatya Nisham, Dukka, Dukka, Dukatya, Agni Rivalaji. That is, there is severe burning sensation during the appearance of lesion. The lesion is in vesicle form, which is reddish white in color, and other features like thirst and consciousness and fever will be seen. And the vesicle may burst to give intolerable pain, burning sensation that spreads all over the body. And this type of Pidaka gives dreadful symptoms and pain to the patient. And the Vinata, that is Avakada, Ruja, Kleda, Prishte, Va Apyudare Abiva, Mahadi Vinata Nila, Pidaka Vinata Mata. That is, the Pidaka of this type is very deep seated with pain and thick discharge. The Pidakas will manifest in back or abdomen. The size is bigger, having bluish discoloration and depression in the center. The last one is the Vidrati. Vidrati, Dvida Mahu, Bahya Abhintarim Tada, Bahya Tuksnyayu Mamsotha Khandaraba Maharuja, Shidakha Anna Vidahi Ushna Ruksha Shushka Adibochanat, Viruddha Achirna Samklishta Vishama Satmya Bochanat. That is, this is ulcerative in appearance and is quite deep and painful, and this appears either inside or outside the body, that is Bahya or Abhyantara. And the ulcers appears outside the body, involves skin, muscle, tendons, and gives severe pain. So this is regarding Prameha Pitaka. And the Sadhya Sadhyata of Prameha. That is, it is explained that Kapacha is Sadhya and Vaitika it is Prashta Sadhya or Vyapya, and the Vatika is Asadhya. And later Acharya clarifies that that is Prameha with Purva Rupa begins as Kapacha Prameha. Later it continues as Pittaja Prameha. And if Pittaja Prameha continues or disease progresses to become chronic, then finally it turns to Vataja Prameha. And Kapaja Prameha, as it is in initial phase of the disease, and Vataja Prameha is Yapya, and Kapaja and Pittaja Prameha, if begins with Purva Rupa and continues with it, then it is Asadhya. Vataja Prameha is Asadhya, and all types of Prameha may be curable if there is no Meduta. dhatu tushti. And the morbid elements that is in prameha are doshas like kapha, pitta, and vayu, and doshas like medas, rakta, shukra, ambu, vasa, lasika, majja, rasa, ojas, and mamsa. They are responsible for the causation of prameha, which is of 20 types. And the main things that is Medas, Mamsa, and Kleda. These three get invariably vitiated in all types of Prameha. And remaining elements like Majja, etc., do not variably get vitiated in all types of Prameha, or they get vitiated only slightly. So that keep in mind, like Medas, Mamsa, and Kleda. So coming to the and one more thing that is the Jada Premi, incurability of hereditary diseases. That is Jada Premehi Madhumehino Vana Sadhya Uktasahi Dijadoshan Ye cha api kichit kulaja vikara bhavanti tamsha pravadanti asadhyan. That is patients who are diabetic right from the time of birth, that is congenital, and who are born those who are born of diabetic parents, that is hereditary type, are not curable because of morbidity in their genes. Similarly, other hereditary ailments are to be considered as incurable. And here in this shloka, the term Madhumeha that is used to imply Sneha or Prameha in general, and thus if the parents are suffering from any type of prameha, then the manifestation of the same type of prameha in the offspring is considered to be considered as incurable. ಬರ್ತೀನಿ ಇರಿ ನಿಮಿಷ. Hello.
The term Madhumeha no doubt means one of the 20 varieties of Prameha, but simultaneously, both Prameha and Madhumeha are used as synonyms. Keeping in this view, Madhumeha Pitakas, that is described in the Charaka Sutra 17, that is in Kenta Shirasiyam, are referred to in this chapter as only Prameha Pidakas. As the term Trina, that is of grass, it refers to all types of grass in general and also to a particular type of grass. Similarly, the term Madhumeha refers to all types of Prameha in general and also to a particular type of Prameha, that is diabetes mellitus. And this point has already been explained. That is and you can refer the commentary of Sutrasthana 17th chapter. And the differential diagnosis of Prameha, that is if the color, that is between Raktapita and Prameha, that is if the color of the urine is yellow or if blood is excreted through the urine without the prior manifestation of premonitory symptoms and symptoms of Prameha, such a person should not be diagnosed as a patient of Prameha, and he should on the other hand be diagnosed as a case of Raktapitta. And both Prameha and Raktapitta share many common signs and symptoms. To guide the physician not to treat Raktapitta patients on the line suggested for Prameha, the differential diagnosis of these two has been given. Okay. And next comes into the Prameha Chikitsa. That is the line of treatment. Before that, um, like in basic pathology, we have to categorize the Kapacha Prameha as a particular group and the Paitika and Vatika Prameha into another group. And you have to keep in mind that in Kapacha Prameha, all the doshas, the 10 doshas explained are in Vriddha state. Okay. And in Pitta Vatika Prameha, doshas are in Kshina Avastha. So the Chikitsa also in categorized like Kapacha. Kapacha is one category, and next is the Pittavatika. And also it is like in Sushruta, it is said that the Prameha, which is not uh, like which is not occurring in the not in the normal bulky medas, but in which condition it is affecting is, and he explained it as Bahu Abadha Meda. That is, we can consider it as a circulating free fatty acids. And also that is the Medasa Aparinidam. That is, in commentary it is given Amarasavat Adisnittam. In that is like the Amarasavat Adisnittam. In those Medas, and that is the Medas and not the bulky Medas. So the treatment is also like, so the patient suffering from Prameha can be classified into two categories. That is Stula and Krisha. That is Stula
and Balavan and Krisha Durbala. So patient belonging to the Krisha that should be given nourishing therapy or Brahmana line of treatment. And patients, those who are strong Balavan patient, those who having more doshas, in that condition in the body should be administered with Shodhana line of treatment. And for that is in Stula Pramehi, we can like those fit for Shodhana, only for those Shodhana therapy is indicated, and those unfit for Shodhana, those who are, if the Stula Pramehi and Balavan, if they are Shodhana Anarha, then we have to give Shamana line of treatment. The Sandarpana Chikitsa, that is depending upon the Agni we have to give. Okay. And if Apatarpana Chikitsa is prolonged, it may cause Gulma, Kshaya, Shula in Mehana and Vasti. Therefore, Sandarpana Chikitsa must be done judiciously. That also you have to keep in mind. And in Shodhana, we have to administer Vamana and Virechana after giving proper Snehana. And after Vamana and Virechana, Astapana Vasti can also be adopted. And other procedures based therapy for Stula Pramehi are like in Ashtanga Hridaya, it is given as Ruksha Udvarthanam Gadam Vyayamo Nishi Jagara Echa Anyat Shleshma Medognam Bahirandasya Tadhitam. That is from Ashtanga Hridaya Chikitsa 12th chapter. That is Ruksha Udvartanam and physical exercise, keeping awake at nights, and Shleshma Medohara Chikitsa. And next is the Shamana line of treatment. That is, it is given like diseases like Mutra conditions, like diseases like Mutra Graha, Ruja, Gulma, Kshaya arises as a result of Avatarpana. And patients who are not fit for Shodhana and for Krisha Pramehi, the line of treatment is Shamana. For examples are like Haridra plus Dhatri Swarasa plus Madhu, and Haridra, Surahwa, Tripala and Musta boiled in water, and Kashaya of Chitraka, Tripala, Darvi, Kalinga added with honey, Guduji Swarasa plus honey, Amalaki Swarasa plus honey. That is, the shloka is from Ashtanga Hridaya Chikitsa, 12th chapter, 5 to 7 shloka. That is, Dhatri Rasaplutam, Prani, Haridra, Makshikanvidam, Darvi Suraha, Tripala Mustava, Kwadita Jale, Chitraka, Tripala, Darvi, Kalingan, Va Samakshikan, Madhuyuktam Guduchya Rasamamalagasya Tva. And there are many diet which is explained in Charaka Chikilsa. That is, the patient suffering from Prameha should be given the following food, that is mantha, kashayas and barley powder, that is yava churna, linked is prepared of yava and other light like other things. And Yavodhana, without adding any unctus articles, and Vatya, that is like, and Saktu, Apopa, that is mixed with the meat soup, and old shali rice cooked and mixed with the soup of mudga, etc., and preparations of bitter vegetables, and cooked shashtika rice and trinadhanyas mixed with the oil of dandi, ingudi, adasi, and sarshapa. And also in Sharaka, you can see the importance of barley, importance of Vyava in Prameha. That is like the shlokas from 21 to 24 in Sharaka Chikitsa. And in that, it is given as the patient suffering from Kabacha Prameha should take food items prepared of Vyava mixed with honey. And also Yava soaked in the decoction of tripala and kept overnight should be mixed with honey, and that is a tarpana diet, and it should be given by the patient suffering from prameha regularly to overcome this disease. And also Yava should be soaked separately with each of the decoctions prescribed for the treatment of kapacha prameha and taken by the patient in the form of sattu, apopa, and the fried barley and other types of eatables along with guda. And there are various food preparations which is with the barley is explained, that you can go through that. And usually some recipes also it is like the patient suffering from prameha should take the decoction of darvi, surahua, tribala, mustam, and some recipes are also explained. And for kabacha prameha, these are the recipes, that is the decoctions that should be mixed with honey and give to the patients, like a decoction of haritaki, katfala, musta, lodra, pada, vidanga, archana, dhanvana, all these things like tarvi, vidanga, uh, sorry, tarvi, vidanga, ghatira, dhanva, surahua, kushta, aguru, chandana, and decoction of pada, murva, shwadamshta, and these are for the kapacha prameha. And decoctions for pittacha prameha, that is also decoctions of ushira, lotra, anjana, chandana, and decoction of ushira, musta, amalaka, abhaya, and like patola, nimba, amalaka, amrita, all these kwatas. Then you can go through this. And the formulations like madhva sava, dhandya sava, ballataka sava, and various external applications are also explained. That is uh, like exercises, unction, Agdas bath, sprinkling of water over the body, and application of ointment made of ushira, tvak, ela, aguru, chandana, etc. The apatarpana therapies are also explained, like aggravated kleta, medas, and kapha, that we already said. We already explained that the aggravated kleta, medas, and kapha are responsible for the causation of prameha. So, keeping in this, we have in the beginning we have to administer the apatarpana therapies to patients suffering from kapacha and paitika types of prameha. That is what just now I explained. Like administration of apatarpana, it is that it will cause to diseases like gulma, conditions like gulma. So the physician should be careful not to provoke the manifestation of such diseases while administering the apatarpana treatment. Okay.
And also what this is regarding prameha, and also like and in Vadika Prameha, it is Vasa Meha, Lasika Meha, all comes under Vadika Pramehas. Like in one more thing, that is usually uh, according to the Chaya Karana Vidvesha, that is if Chaya Karana Vidvesha means if a particular dosha or dhatu, if it is aggravated, then usually, generally, what will happen? We will have aversion towards the same quality properties. If I have like pitta aggravation, then if pitta aggravation is there, then it will lead to like ushna tishna items, aversion towards such things. But if you see the prameha, like in prameha already medovritti is there, but still the person is having more hunger. Polyphagia is there. Then five. But according to Chayakarana Vidvesha, it is if a particular dosha is aggravated, then we have to have aversion towards that. But this is an exception. As in Prameha Rogi, he used to take more food, right? In Prameha already Medhavritti is there. So in that the Samprapti, it looks like an Avarana Samprapti, and it is like for Adhistula, Medo Avarana will be there, and so the Vata Prakopa will also be there in the Koshta. So definitely Agni Vriddhi will be there, and it leads to overeating. So that is one point. And one more thing is this Vedana that is contraindicated in disease prameha. That is very very important because already we said it is due to the Klayeta is involved in this, because not only in prameha it is contraindicated, but also all diseases which is having predominance of Kleda, which is due to Kleda. That is the diseases like Kushta, Masurika, Visarpa. In all these diseases, there is involvement of Kleda. So, if we administer Speda, what will happen? There will be Medo Vishiranatvam. Or the Kleda will be, uh, if we administer Speda for Prameha Rogi, then the Kleda will increase and all the Kledas will go through the Mutram. Because that is why we said Anna in first sentence I have said Anna Kleda Nirvahanam Mutra. So it will expel all the kledas from the body. So if we administer Spetana, then kleda will be more, and the prameha that will worsen the condition of prameha. So if the kleda increase, then it will go through the urine, and then that is the increased prameha state will be worsened. So we have to that is it. So Svedana should not be administered. And if it in case we want to administer, then Mridu Sveda we can administer. Okay, because the disease prameha itself is the body doesn't know how to deal with this kleda. That is why when I explain the signs and symptoms of diabetes mellitus, we explain symptoms like constipation,
and also like constipation we explained, and also dry skin, and also the carpal tunnel syndrome, and all those things like shoulder pain. Because in all these cases, uh, like uh, the cleda is expelled through the body. So literally all the kledas from the body it is expelling. So that is why it become more dry. So that is why reason for dry skin, constipation, all this. Okay. And clinically you can give like drugs like nisha katakati kashaya, kataka katirati kashaya. Especially nisha katakati is for paitika conditions, and kataka katirati is for kabacha related. And in case of Vadika, we can't give any Kashaya formulations, that's which is explained here. In this case, you have to give like medicated oil, or should be processed with the decoction of kapha alleviating drugs. That is clinically we can give Dhanvantaram Ghritam, which is Dhanvantaram Ghritam which is explained in the context of Prameha. And in that case, we can't administer any um, kashayas, because that is why the Vadika Prameha, which is explained as asadhya, because in that case we can't give any other medicines. Like already, if we give for Vadika, the line of treatment will be opposite properties. So if we administer Brahmana line of treatment, already Medho Vritti is there. So that is why no treatment is there for Vadika Prameha. So if we are giving, we can give Sneha preparations or Dhanvantara Gridala preparations. And also other formulations we can give in um, Premehas, Nirviryati Kulika also we can give. The reference is from Sahasra Yoga, and also Shiva Gutika and Kanmada Basma also, like that also we can give. Um, and that acts as a rasayana also. And also the natural insulin contain drugs are like bilwa leaf you can use, and bindi leaf also, like ivy gourd leaf, that also contains natural insulin. And especially you can safely use that bilwa leaf also. And sometimes and almost all the time it should not be like sequential order, like already it is explained, like it is like kapacha prameha, it will become pittacha prameha, and later it will become vadika prameha. But it should not be true all the times, because sometimes it will be in this sequence, like kapacha, then pittacha, then at last it leads to vadika prameha. But other than this also prameha will happen. That is, it is due to the swanidana. That is, for example, if a person who is taking pitta vardaka ahara vihara, or that is the pitta nidanas, that will lead to the paitika prameha. So just go through the paitika pittacha prameha nidana and kabacha nidanas, and that is maybe in sequence as the pathology itself, or distinct different pathology. So in sequential pathology, that is Kaba Pitta Vata. That is so called the Kaba, that is the Kabacha Prameha, that is the pre-diabetics. We can, this is not a direct correlation, but we can tell pre-diabetic means the Kabacha Prameha, or the diabetic it is a Pitta Vasa, and the complication is Vadika Prameha. But it doesn't mean that only Vadika Prameha have complications, but also Kabacha Prameha have its own complications, and also Paitika have its own complications. And clinically, the Kabacha prameha, the onset is very slow, and it is basically kaba, and it is basically drava pradhana, and the bahu abadhameda, mamsa, kleda, and all these dushyas will be present, or it will be present, and others will be present minimally. This is kabacha, and in pitta prameha, it is paitika, and there is importance of rakta in that. Rakta dushti will be takes place in paitika prameha, and the onset will be very rapid. And the vadika prameha, vadika prameha also, it is vada pradhana and it is asadhya. And if there is an individual onset, then it will be rapid onset. Okay. So, what we discussed in Prameha, it is first we discussed about what are the Medovaha. Keep in mind about the Medovaha, Strodo, Medovaha, Strodo Mula, that is Prika and Vapa Vahana. So, this is the summary. To summarize, first we explained about the Medovaha, Strodo Mula, that is Vrika and Vapa Vahana. That is Prameha is a disease of kidney, and the in modern also now it is proved, and that is the renal damage also starts if person is diagnosed with Prameha, and that day itself the renal damage will also start. Uh, and then that is Vrika and Vapavahana. Vapavahana we can take it as an adipose tissue. Uh, and next we explained about the mutra that you have to keep in mind. Mutram is annakleda nirvahanam mutram, and sveda is svedasya svedam kleda dharana. And also keep in mind about the morbid elements that is like doshas like kapha, pitta, vayu, doshas like medas, rakta, shukra, kleda, vasa, lasika, majja, rasa, ojas, and mamsa are the responsible for the 20 types of prameha. And in that, Medas, Mamsa, and Kleda are three doshyas which is vitiated in all types of prameha. That also you have to keep in mind. And when it comes to Nidana also, usually that is the Nidana Parivarjana is the first line of treatment. So we have to, uh, if a patient comes to you also, you have to tell the Nidanas, because so in Nidana you have to keep in mind that not only the Madhura Rasa but also Madhura, Amla, Lavana. Three rasas are causing the disease Prameha. So we have to advise not to use to reduce Amla and Lavana Rasa also. In Nidana that you have to keep in mind. And we discussed about the Samprapti, Purva Rupa, and the types like Kapacha 10, Pitta 6, and Vata 4. And also about the Prameha Pitakas. And one more thing I forgot to said about the treatment of Prameha Pitaka. That is Prameha Chikitsa. Like it should be treated by Shalya people, like surgeons, with the help of Shastras, Samshodhana, and Ropana therapies. Because the Pidaka, which is caused by Prameha, are described in the Kendra Shirasiya of Sutrasthana, Charaka Sutrasthana. So treatment of these pidakas, that is with the Shalya people, and the so this is one, and we explained about the we explained about the pitakas, prameha pitakas according to Sushruta 10 and according to Charaka 7. And also we explained about the Chada pramehi, that is hereditary diabetes. And next we explained about the treatment, that is the line of treatment, that is the prameha rogi can be categorized into two, that is Krisha pramehi and Stula pramehi. So the for Krishapramehi, those who are Krishapramehi, sorry, Stulapramehi, Balavan, that is those who are obese and strong, the line of treatment is Samshodhana. Samshodhana, if the patient is Arha for Shodhana, then Samshodhana. Otherwise, the line of treatment is if the patient is not fit for Shodhana, then the line of treatment is Shamana. And for Krishapramehi, Krisha and Durpala, in that case, the line of treatment is Brahmana. And also, if the apatarpana chikitsa, if it is prolonged, it may cause gulma, kshaya, shula, and therefore sandarpana chikitsa must be done judiciously. So this is regarding prameha chikitsa. And the research updates on the previous question will be given in the detailed notes. Any queries or anything?